My name is James McIntyre. I am a physician, I am a board-certified pediatrician, and I am also a certifying specialist in the Missouri Medical Marijuana Program. I am a board-certified pediatrician, which is considered a primary care field, but it is certainly a more specialized field than general practice. Yes, I have experienced relationships with patients in single and multiple limb amputation, as well as other body parts, including earlobes and scalp and burn skin victim injuries.
My name is Matt Lutke. I'm a certified prosthetist orthotist with Hanger Clinic at the University of Kansas Medical Center in Kansas City, Kansas. I've been with Hanger since 1996. I began as a technician fabricating artificial limbs and then went to Northwestern for orthotics and prosthetic school, came back, did 2 years of residency, completed my board exams, and then began practicing.
One of the hardest things for a patient to deal with, in my opinion, when they experience nerve damage, which is a congruent part of an amputee, the central nervous system of the human body is extremely complex, but it is also plastic and adaptive. But the human body, during the acute and sometimes chronic phases of healing, gets false signal input to the central nervous system from the absent limb region. The peripheral nervous system feeds those signals from the terminal end of the nerve groups, and the brain processes those input in a fashion that it tries to adapt, but oftentimes misinterprets. These nerve signals can be anything from what we consider paresthesias, which can be tingling sensations or annoying numbness sensations, all the way through the spectrum of extreme pain. What a patient must do to properly prepare for the use of an artificial limb in sports activities is, first and foremost, they must make sure that their distal appendage is healed and can accept the prosthesis without damaging the tissue. So using different therapeutic modalities to get 100% healing of the skin flap is important. Using properly fit prosthesis so that abrasions, chafing, and skin damage does not occur is important. And then prepare themselves for the mental challenges that they will almost for certain experience, not only from internal sources, but from external sources. They may be having experiences of prejudice where other athletes feel that they are a nuisance or in their way. So you have to be prepared to realize that an athlete is as much internal as they are external in their mindset to be successful at a high level of function.
My first advice would be, it's going to depend. So right after someone first loses their limb, we need to learn to walk before we run. But as soon as we've mastered walking up and down hills on uneven terrain, then I like to help my patients be able to fulfill any dreams they have. So basically, getting them a loaner running foot, being able to trial a running prosthesis to be able to feel what that's going to be like, so that they know, hey, this is definitely something I want to be able to do. I want to get back to running, or I want to be able to get back to playing football or baseball, softball, participate in all those activities I was doing before I lost my limb. Just like any other athlete, strengthening your body, making sure you're stretching out, working your core muscles, because if you have any kind of weakness within your body, whether it's your hip is weak, your knee is weak, that's going to show up as we're running. So the stronger we can get, the better someone's going to run. And it's one of those things that not all of my patients will have a running coach, but fine-tuning your running takes a long time. And as a prosthetist, I'm not a running coach, but we get people started down that road and then connect them with individuals so that they can continue to improve.
What are the things that an amputee can do to allow them to be prepared for physical and ambulatory and extreme physical activity? That's a good question. The cardiovascular system has been affected because the circulation that went to that extremity obviously doesn't exist anymore. So the nervous system that controls peripheral vascular function, skeletal muscle perfusion, all has to change over time. So the patient needs to maintain cardiovascular health, aerobic activity, and in certain circumstances where they're unable to be able to bear weight, they should utilize water-based therapies and other partial gravity-reducing therapies through physical therapists and specialists who allow them to train to get their cardiovascular and their skeletal muscle responses to be able to handle these new balance, coordination, and adaptations for prosthesis use. A piece of advice that I think would be important to give an amputee that is wanting to begin a running sport or any type of vigorous, high activity, high cardiovascular function event would be to set yourself simple goals and complex goals. Getting yourself to accept simple successes en route to a major success will cause less mental stress where you can't quite grasp that major goal, but you can celebrate minor stepwise systematic goals to reach the ultimate goal. So you will be able to then get satisfaction that you've made these stepwise, and yes, there's going to be small obstacles that you're going to have to overcome, but trying to make small graspable, I don't know what the term I should be using, in order to make small goals and accept satisfaction in those small successes, and then eventually reaching your major goal and the euphoria that you have been a champion, you have overcome your impairment, and that is the ultimate goal of most amputees that I've had relationships with.